funding crisis involving the United States Agency for International Development, USAID, has plunged South Africa's HIV treatment programs into chaos, leaving thousands of people living with HIV at risk of losing access to life-saving medications and support services. The disruption, caused by delays in the disbursement of funds, has exposed the fragility of healthcare systems reliant on international aid and raised urgent concerns about the long-term impact on one of the world's largest HIV-positive populations. Subscribe to this YouTube channel to stay updated. You can also like this video and share your views in the comment section below. The funding shortfall. USAID is a key contributor to South Africa's HIV response, providing critical financial support for antiretroviral therapy, ART, prevention programs, and community outreach initiatives. However, bureaucratic delays and administrative challenges have stalled the release of funds, creating a gap in resources for local organizations and healthcare providers. This has left many clinics struggling to maintain supplies of medications and retain staff, while community-based programs face the threat of closure. South Africa, home to over 7.5 million people living with HIV, has made significant progress in combating the epidemic in recent years, largely due to international funding and partnerships. The USAID crisis threatens to reverse these gains, jeopardizing the health and well-being of vulnerable populations and undermining efforts to achieve the United Nations goal of ending AIDS as a public health threat by 2030. Impact on patients and communities. For individuals living with HIV, the funding shortfall has created a climate of uncertainty and fear. Many patients rely on regular access to ART to manage their condition and prevent the virus from progressing to AIDS. Disruptions in medication supplies could lead to treatment interruptions, increasing the risk of drug resistance and worsening health outcomes. Community health workers who play a vital role in educating and supporting patients are also facing layoffs and reduced resources, further exacerbating the crisis. The situation is particularly dire in rural areas, where healthcare infrastructure is already strained and access to services is limited. Patients in these regions often depend on mobile clinics and outreach programs funded by USAID, many of which are now at risk of being scaled back or discontinued. The crisis has also highlighted the disproportionate impact on women and children, who make up a significant portion of South Africa's HIV-positive population, to broader implications for global health. The USAID funding crisis underscores the challenges of relying on international aid to address public health emergencies. While donor funding has been instrumental in advancing the global HIV response, it has also created a dependency that leaves recipient countries vulnerable to disruptions. The situation in South Africa serves as a stark reminder of the need for sustainable, domestically funded healthcare systems that can withstand external shocks. The crisis has also reignited debates about the role of international donors in global health. Critics argue that funding delays and administrative inefficiencies can have devastating consequences, particularly in low- and middle-income countries. There are growing calls for greater transparency, accountability, and coordination among donors to ensure that resources are delivered promptly and effectively. A call to action. As South Africa grapples with the fallout from the USAID crisis, there is an urgent need for immediate action to address the funding gap and stabilize HIV treatment programs. International donors, including the U.S. government, must prioritize the timely disbursement of funds and work closely with local partners to mitigate the impact on patients. At the same time, South Africa must accelerate efforts to strengthen its healthcare system and reduce its reliance on external aid. The crisis is a sobering reminder of the fragility of progress in the fight against HIV/AIDS. Without swift intervention, the gains made in South Africa and other high-burden countries could be lost, leaving millions of lives hanging in the balance. The international community must come together to ensure that no one is left behind in the pursuit of a world free from AIDS.